Borderline personality disorder is defined by the DSM-5 as a pervasive pattern of instability of interpersonal relationships, self-image and affects, and marked impulsivity. The diagnostic criteria for BPD is indicated by 5 or more of the following: frantic efforts to avoid abandonment, unstable relationships such as the love-hate cycle, identity disturbance, which are persistent unstable self-image or sense of self, impulsivity in 2 areas that can cause damage, such as fiscal irresponsibility, promiscuity, substance misuse, suicidal behavior, gestures, threats, or self-mutilating behavior, affective instability due to a marked reactivity of mood, for example, intense irritability or anxiety, chronic feelings of emptiness, inappropriate intense anger, and transient stress-related paranoid ideation or severe dissociative symptoms. Attachment, as posited by Bowlby, is a lasting psychological connectedness between human beings, the consequences of which can echo throughout the entire lifespan. Unfortunately, however, there are children who have no predictable pattern of attachment, and these children are said to have a disorganized attachment style, which can lead to a greater risk of psychopathology in adolescence and adulthood. Contending theories tend to agree that disorganized attachment in the parent-child dyad is catastrophic for developmental outcomes of a child. According to an archival study by McVie in 2009, disorganized attachment stems from fear of the mother with BPD, so much so that a child becomes caught between a desire to approach or a fear of doing so. A child learns to develop alternative means of coping with stressful situations because they expect that their mother is not likely to help soothe them, and instead of being a secure base for the child, the mother is often the one who is posing the threat. BPD mothers are likely to pass down their own disorganized attachment status to their children, and there have been several studies which indicate that a maladaptive attachment style in infancy is a causal factor for BPD development later in life. In a 2003 study by Crandall, Patrick and Hobson, it was discovered that 2-month-old children showed less responsiveness towards their BPD mothers. Subsequently, at 13 months old, 80% of these children displayed disorganized attachment. Unfortunately, this percentage is the same for maltreated children. A longitudinal study by Reinhold found that BPD symptomology of a parent, specifically a mother, can predict the number of borderline criteria in their children, and that a maladaptive parent-child dyad can lead to severe psychopathology in the future. Previous research methods have included surveys, interviews, experiments, and archival study. The still-face paradigm and the Ainsworth strain situation experiments have been used to observe the behavior of children toward the BPD mother. Interviews such as the Adult Attachment Interview, the Adult Attachment Projected Picture System, and the Attachment Multiple Model Interview are used extensively in BPD attachment research, along with self-report questionnaires. Longitudinal research has sought to understand the developmental impact of disorganized attachment. Given the robust nature of the most common tests in evaluating attachment toward BPD mothers and their continued use, it could be argued that these are appropriate and valid measures of assessment. But on the other hand, it could also be argued that in the case of young children or adolescents, self-report questionnaires, surveys, or interviews are subject to bias given the emotional dysregulation and fear surrounding their BPD mother. For example, they might think, "What if my mother finds out what I have said? I might get into trouble." Additionally, these research methods are open to retrospective bias if used in adulthood. An adult child of a BPD parent may have strong internal working models of attachment and could have remained resilient against the symptomology of BPD. Thus, they had the capacity to understand that their upbringing was not the norm. Longitudinal research is essential for understanding the developmental outgrowth from being raised by a BPD parent and the impact it would have at various ages in the lifespan. Sadly, these studies are incredibly rare and are often mixed-type research methods involving archival study and self-report measures, rather than face-to-face interviews or observational techniques. Several factors make research in this field difficult. Firstly, ethical standards such as consent from caregivers with parental responsibility is likely to involve one or both parents or caregivers with BPD, and it's likely that such individuals could shy away from putting their lives on display for fear of being stigmatized in some way. Secondly, as previously mentioned, children are likely to be trauma bonded to their BPD parent and not express their world or the interpersonal relationship views reliably. Thirdly, if aiming for longitudinal or mixed methods research design, attrition rates are likely to be high given the impulsivity and emotional dysregulation of the individuals involved. Additionally, sample sizes are generally small and exclude triadic relationships between mother, father, child, and generally focus on just mother-child attachment styles. Further, extraneous variables such as socioeconomic status, education level, sexual orientation, and other demographics are often ignored in research such as this. Previous research surrounding BPD mothers and their attachment to their offspring has been varied, with most of the focus centered on the parent and not the outcomes for the child. While it could be argued that history repeats itself due to the likelihood of transmission of symptomology from mother to child, this should not negate the importance of seeking appropriate interventions, treatments, or mental health programs. Indeed, research has shown that if treated adequately in early life, symptoms can be mitigated and prevented from becoming durable through adulthood. But what if the antithesis of disorganized attachment, so secure or organized attachment, could protect or reverse the impact of a BPD parent? Recent research has demonstrated that both parents influence the outcomes of attachment and that a secure relationship with one can mitigate the disastrous consequences of the other. However, this research did not focus on a triadic relationship between the mother, father, child, but rather children with BPD and control children and their relationship with the father. It would be appropriate, therefore, to research a child's relationship towards both parents, preferably one with BPD and one without, to determine the protective factor of secure versus disorganized attachment. Given that so much research has focused on the dyadic mother-child interaction, it is important to implement interventions for children to safeguard them against durable personality or identity disturbances. The cycle must be broken by researching and providing appropriate interventions for children so as to allow them to lead a positive and adaptive life. As BPD mothers are likely to experience tumultuous interpersonal relationships, marital or de facto breakdowns are likely, and thus a father figure may be removed from a child's life either entirely or on a restricted basis. In Australia in 2019, 45% of court orders provided mothers with sole custody, whereas fathers achieved just 11%. Losing or having limited connection to a secure attachment could have disastrous consequences for a child of a BPD mother, and thus we must understand the importance of the secure father figure or other caregiver in the child's life. This could be the very first protective intervention against BPD that has been so far overlooked in the research field, and the potential for this to be used as a safeguarding tool for children in the future in both parenting strategies and legal settings is immeasurable. Thus we come to a possible research question. Can secure attachment to a caregiver protect against the deleterious psychopathological consequences of BPD transmission from mother to child?